Okay. Close your eyes and imagine that you are with your child and they die suddenly on the spot. Later, the autopsy will indicate that your child's death was caused by the use of Ritalin. Right now, you may be thinking that this situation is impossible, but it has happened several times. One family lost their 14-year-old son Matthew due to the use of Ritalin that was prescribed by a doctor. According to Dr. LaJuba, a chief medicine in Michigan, states that Matthew's autopsy indicated that his heart showed clear signs of vessel damage caused from a long-term use of Ritalin. Even though this does not happen with every child, it obviously shows that by giving this child Ritalin was the cause of death and a cause of abuse. Through my extensive research by looking at many different websites, databases, case studies, I discovered massive amounts of research and evidence that clearly proves my claim. I strongly believe that based on the data and scientific studies, one can conclude that giving a child Ritalin is a form of abuse. The proof that Ritalin is child abuse is shown through the definition of child abuse. The short and long-term effects of Ritalin may cause, in many case studies and experiments. Let's begin with the definition of child abuse. Child abuse entails many aspects of harm. Even though the definition varies, it is defined on standards set by the federal law. According to the National Institute of Health, states that child abuse is defined as doing something or failing to do something that results in harm to a child or puts a child at risk of harm. Child abuse can be physical, sexual, or emotional. Neglect or not providing for a child's needs is also a form of abuse. Now that we know the definition of child abuse, let's look at the short-term and long-term effects, which will show that by giving a child Ritalin is abuse. The short-term effects by Ritalin prove that it is abuse when given to a child. There is a massive amount of short-term effects that are shown for abuse. According to the Food and Drug Administration database, states that short-term cardiovascular effects include rapid heartbeat, high blood pressure, irregular heart rhythms, and possible heart attack. Central nervous system effects include altered mental status, depression, suicide, hallucinations, tics, new or worse behavior, or aggressions. Research done at the NIMH states that out of the 45 children studied, that there was an increase of 69% of depression. Also, he states that there are 76 that suffered from an increase of tics. Diagnostic Manual of Mental Disorders states that Ritalin causes severe psychological disorders, including depression and suicide. Other short-term effects include joint pain, blurred vision, blood disorders, worsening of ADHD symptoms. And this was all cited on the FDA's website. The long-term effects clearly show that by giving a child Ritalin is abuse. Long-term effects also include many indications of abuse. According to the FDA's research, and the drugabuse.com states that studies have shown possible depression lasting into adulthood. Neurosystem effects include difficulty in experiencing pleasure due to short circuit of the brain's reward system. Emotional response includes chronic exposure to Ritalin leads to decreased sensitivity to the reward stimuli, while resulting in increased negative responses to adverse situations. The last long-term effect is death. According to the FDA, during the last 10 years, there has been 186 deaths in children for using Ritalin. Now that you see that there is an unnecessary harm caused by Ritalin, let's take a look at studies that prove some of these side effects. Through these case studies, you will see how abusive this drug really is. Ritalin is similar to cocaine. To prove this, research To prove this research was done at the Brookhaven National Laboratory by Dr. Nora, a psychiatrist and imaging expert. Her research indicated that using brain imaging, scientists found that in the pill form, Ritalin taken by 4 million children in the United States occupies more of the neural transporters responsible for the high experience by addicts than smoked or injected cocaine. The research may alarm parents whose children have been prescribed Ritalin. This was cited in the Journal of the American Medical Association. A case study shows that if a child takes Ritalin at a young age, there are long-term effects. Rats were studied for a long period of time after receiving Ritalin. They discovered that there is a higher link of getting depression in adulthood, stunt growth, and learning deficits. This was conducted by McLean Hospital in the National Institute of Health, published on December 20th, 2004. According to the National Institute of Mental Health, there were severe risks were children who took Ritalin. Their study indicated that it found that teens on Ritalin have a high risk of sudden cardiac death. The DEA puts warnings on Ritalin labels. This includes warnings starting at causes nervousness, heart irregularities, and weight loss. Another warning states aggressive behaviors, suicidal behaviors, heart attacks, depression, and sudden death. I found, and this is found at the National Institute of Mental Health. Let's take a look at the natural approaches. There are other natural approaches that parents should look at first before giving their children Ritalin. You can take a holistic natural approaches such as Chinese medicine, chiropractic care, homeopathy, or just to name a few. Through my research, I have found that these are all safe, natural alternatives that do not have any of these side effects that Ritalin has. This brings me to my conclusion. In the end, the evidence that I have given you supports my claim that Ritalin is a form of child abuse. Giving a child this medication is an act of failure that puts a child into unnecessary physical and emotional harm. In several ways, by looking at the natural approaches, parents can avoid abusing their child with this potent drug. Ritalin is a form of abuse, and it is proven through the definition of child abuse, side effects, and scientific studies that I've discussed earlier. Okay, these are just a few of the short-term and long-term effects that I discussed earlier. Some are sudden death, nervousness, insomnia, cerebral arthritis, blurring of vision, hostility, aggressive behavior, and the list goes on, and this is just to name a few. Okay, what if your child was prescribed Ritalin? The evidence shows that the dangers outweigh any possible benefits. Would you let your child take it?